Let's get the read on all of that, including these confirmation hearings that are continuing now for Judge Neil Gorsuch with Senator Mike Rounds of the beautiful state of South Dakota. Senator, am I right on that? And then the market's fears, sir, that this could, at least on the health care stuff, be unraveling?
Well, I think it's like we talk about legislative processes being like making sausage. It's not always fun. It doesn't look very good. But in most cases, if you do it correctly, you come out with a good product in the end. And this is one that we want to get done correctly. And I don't think we ought to put a time limit on it. I think we ought to work our way through it. But the end result is what we've got to have, and it will be better than Obamacare. Obamacare is in a death spiral.
Well, do you think the measure that has been sort of tweaked a little bit now, that was meant to win over conservatives, I don't know where moderates stand on this, they're kind of a wash, I guess, but that it wasn't tweaked enough, it wasn't, fixed enough, and that even the likes of Rand Paul telling me yesterday, sir, that he can't support it, won't support it?
Well, I'm not going to go so far to say that I would not support it. I haven't seen what the House did this morning, but I can tell you that our goal should be to look at the end result after everything is done and whether or not we actually have a fair and open marketplace that provides for good competition. And I think there's a couple things we've got to do with the tax credits. I think we've got to open those up for group health insureds as well. I think that's a big part of the deal that I'm concerned with right now.
Do you think those tax credits, Senator, are a subsidy?
Well, sure, they're a subsidy. No question about it.
The reason why I mentioned, not to belabor the point or rudely interrupt you, I apologize, that seems to stick in the craw of a lot of your conservative colleagues who say, no, we know what the agenda is here, and it's Obamacare light, Obamacare 2.0. You've heard all of that. What do you say?
Yeah, look, it is not Obamacare, because Obamacare was based on basically trying to get us to a single-payer system. And what they were trying to do is say there's going to be a one-size-fits-all with regards to the health benefits that you can actually get. The only thing they can change were deductibles and copays. Under the plans that we're talking about right now, there'll be innovation again. The states will be actively involved. You'll be able to pick and choose the types of coverages that you actually want. So for me, look, we do Medicaid right now, and that's a recognized part of the safety net. What they're really talking about is expanding on a limited basis the amount of dollars going in to incentivize people to actually buy health care and to put more of their money into it. I just want to make darn sure that when we're all said and done with it, that we've got the most efficient delivery of health care that we can possibly get. And that means a competitive system, multiple companies vying for the consumer's dollars, innovative products, and actually put into place a plan in which we can actually allow for health care costs to start to go down again. And when you've got regulations like you've got right now at the federal level, you're not encouraging the reduction in health care costs that are ultimately passed back on to the consumers. What you end up with is more people paying higher and higher costs that they can't afford and getting out of the market. And at the same time, more people ending up on Medicaid. And when you have people on Medicaid, the rest of us are going to subsidize that, because Medicaid doesn't pay the full bore. It only pays a part of it. That's passed on to the private market, and it increases everybody's prices. We've got to do everything we can to strengthen the private market, group in particular, because that's the most efficient delivery system out there, and allow for innovation in the systems and allow doctors to actually get back down to actually treating patients rather than filling out forms.
Senator, I've heard from a number of liberals, too, who said, we've won on this, Neil. And paraphrasing again, their thrust was Republicans are arguing just how big a government health care program they're going to end up with. They want it to be smaller than what we've got, but it will still be mighty big. So we win. No. What do you think?
We've always had government involved in health care for generations. Look, we've got Medicare, we've got Medicaid. But if you don't have a healthy, separate private payer system with the vast majority of Americans on it, then you can't afford Medicare and Medicaid, because it is subsidized by the private sector paying higher prices because we're paying a lower price for Medicare and Medicaid. So the doctors are still going to get their money, the providers are still going to get their money, they've still got to operate the hospitals, they're still going to have the innovative approaches and new technologies that everybody wants. The reality is that you can have that if you have a healthy private insurance market. That's what we've got to focus on is what do we do to make the private health care market as efficient as possible, but also as healthy as possible.
Obviously, the president was worried enough to come up to Capitol Hill and meet with your colleagues today. Do you think he has reason to be worried?
Yeah, I think he does. I think there's a reason to be worried because the plan's not perfect right now. And everything that we should do...
Will it be perfect by Thursday? And is Thursday a drop-dead date at which it should be perfect?
Well, I think what they're going to call perfect in the House is whether or not they can get a majority vote out of the House. And I think they'll get something done in the House.
Really?
But then when it comes to the Senate, we start all over again. And I think there's a lot of us that are looking at this saying, look, we're only going to get one opportunity to really send the message that we're going to do it right. And we all want to get to yes. I really do believe that. I think we all want to get to yes. The question is, what's it going to take to assure us that when we're all said and done, we've got a product that people look back at it a year from now, 2 years from now, 4 years from now, and say it's a good thing they fixed that because it's so much better than Obamacare ever could have been.
All right, Senator, thank you very, very much for the whole breaking news. We do appreciate your patience and taking time.